Yeah, we're live.
Wait, Dad, do we have to invite people? Do we have to let people in?
I think I believe you're live already, so you can actually get started. There
Oh,
are
okay.
there are people already in the audience.
Oh, okay. I'll just give it a couple minutes.
Sounds good.
Okay, I think we should get started now. Okay. Hi, welcome. This is my presentation, The Role of AI in Healthcare. So, a bit of an introduction. My name is Sanya Kwarmanku, and I'm a rising sophomore in West Windsor Plainsboro High School South in New Jersey. I really enjoy learning about science and biology, and I hope that when I'm older and after high school, I'm able to pursue a career in healthcare. I am also a part of my school tennis team, and I volunteer at a facility called Princeton Tennis Program, also known as PTP, where I coach autistic kids and I teach them tennis, basically. Yeah. Would you like to say anything, Dad?
Sure, thank you. So, along with Sonia today, this is her dad. I'll be presenting some additional information on health insurance topics as well, especially how it aligns with artificial intelligence. Just a little background about myself. I work for a large health plan in New York as a director of enterprise delivery services. So, I'm hoping I can bring in some of that industry expertise into this discussion.
Okay, so the first question we should all be asking is what exactly is AI? AI stands for artificial intelligence, and basically what this is it refers to is it's the duplication of human intelligence in machines that are programmed to think and learn like humans. Next slide, please. Yeah. So again, what is the purpose? The purpose is to create intelligent systems that can reason and learn from experiences and their interactions with their environment to help in situations and achieve specific goals. So, an example of AI that you might be familiar with already is Siri, like on iPhones, Alexa, and like chatbots. Yeah. So, what are the types of AI? So, the first two types are narrow AI, which is more on the weaker side. And this specific type of AI is designed to perform specific tasks or problems. Some examples are like I just talked about Siri, Alexa, language translating services, etc. Now, general AI is more of the stronger AI, and it's a system that possesses human like intelligence and can understand, learn, and apply knowledge across various areas. Okay, so next is symbolic AI. And symbolic AI uses pre planned rules to mimic human intelligence. Engineers program specific instructions and knowledge into the systems. So in symbolic AI, the engineers are basically programming the technology to do specific tasks. Now, the last one is machine learning and deep learning AI. And this relies on algorithms that allow computers to learn from data and improve their performance over time without being programmed. So the difference is that symbolic AI is programmed to do specific things, and machine learning and deep learning is basically not programmed and they learn based on previous experiences. Okay, so how is AI used in the healthcare industry? AI is used in various ways in the healthcare industry to improve medical diagnostics, streamline processes, and in improving patient outcomes. So, what is the role of AI in hospitals? Some of AI technology used in hospitals are X rays, which produce images of tissues and bones, MRIs, which is magnetic resonance imaging, and CT scans, which also stands for computerized tomography. And what all these are, the X-rays, MRIs, CT scans, they're called like medical imaging. And this type of technology helps doctors figure out what exactly is wrong with the patient and what they need to diagnose. So what is the role of AI in hospitals? AI is used to predict patient outcomes and disease progression by analyzing patient data and recognizing risk factors. This is helpful for doctors in making informed decisions about treatment plans to help the patients. This can also help doctors make more personalized treatment plans that correlate to the patient's medical history, genetic information, and current health status. It can help create more of an effective treatment for the patient. Next slide, please. Yeah. So AI and pharmaceuticals. So what pharmaceuticals basically is, it's the industry where drugs and medication is manufactured and tested. So AI helps identify potential drug candidates by analyzing vast data sets of molecular structures and biological interactions. Machine learning models can predict which compounds are most likely to have therapeutic effects, which accelerates the drug discovery process. AI is being used extensively to improve the design techniques and the required time of the drugs. Let's say, for example, you have a rare disease that there's no cure for. The pharmaceutical industries might decide that they want to try creating a cure, so they'll use AI to help identify what like drugs could be potential candidates. They then test the drug, and then they get it approved by the FDA, which is and then it's then sold on, to help others who have that disease. AI and dentistry. I'm pretty sure 98% of you have all been to the dentist, right? Yeah. So AI algorithms can analyze dental images such as x-rays and scans to detect oral disease, cavities, gum problems, and early signs of oral cancer. I'm sure when you go to the dentist, they take like x-rays or pictures of your teeth to look at a close-up, right? To see like the difference. I know for me, especially when I had braces, they took a before picture and an after picture to see the difference, right? So AI can help detect like things like cavities and oral cancer. AI-powered imaging can assist dentists in making more accurate and timely diagnoses. So next is also AI in dentistry. AI can analyze large amounts of data quickly and accurately, allowing dentists to make more informed treatment decisions. AI can help dentists take a closer look at a patient's teeth with x rays and scans to determine what exactly is wrong with the patient's teeth. Like, do they have cavities or, and like I said, like early signs of oral cancer? Next up is AI in physiotherapy and chiropractic. AI can help monitor patient progress and analyze data. Through machine learning, AI can help physical therapists diagnose conditions more efficiently and provide personalized treatment plans. With the right digital tools, therapy and rehab workflows can be improved and enhanced. So, how does AI help optometrists and ophthalmologists? Now, you may not be familiar with what exactly the difference is between an optometrist and an ophthalmologist. So, optometrists perform the daily routine eye exams. They determine what your prescription is, what your number is for your eyes, right? Whether you're nearsighted or farsighted. So they do that. Ophthalmologists are more they're more like doctors. They perform like medical operations on the eye. So AI analyzes retinal images and scans to detect early signs of eye diseases like diabetic retinopathy, age-related macular degeneration, which is also known as AMD, and glaucoma. AI algorithms can identify patterns, anomalies, and changes in the eye that may indicate underlying health conditions. So, how does AI help with health insurance? I'm sure your parents might have tried to get on call with the health insurance, right? But it must take a long time for them to get help with an agent. So this is where AI comes in. AI algorithms can analyze patterns in data to identify potentially fraudulent claims, helping insurance companies detect and prevent fraudulent activities more effectively. AI powered chatbots and virtual assistants can provide real time customer support, assisting with policy information and guiding them through the claims process.
Great, thank you, Sonia. I'm going to take it over from here. So we talked about different use cases in the healthcare industry, right? So, but if you look at the various domains in the healthcare industry, we're not just talking about hospitals, right? There's an entire support structure that is today built in the United States to support the what we call the healthcare industry. So, hospitals are one aspect. You have pharmaceuticals, the whole process of being able to identify what diseases need to be prioritized for drug development, going through the research process, mining through tons of data and identifying trends where what particular compounds will help a certain disease, going through the clinical trials. There's a humongous process here in the United States when it comes to drug development. You have to go through various phases of clinical trials to be able to get FDA approval. So that whole process takes years. Anywhere an average drug can take anywhere from 3 to 4 years to develop, from R&D all the way down to the manufacturing phase. And then you have, as Sonia mentioned earlier, you have the entire industry around dentistry. You have optometry. So there's a whole gamut of support industries that are today what we call the healthcare industry. And there's a reason why healthcare today in the United States is such a big industry in terms of just GDP and economic growth powerhouse. And if you look at the number of jobs that are coming out of the U.S. and what's the job prospects, you'll always see that healthcare is high there from a percentage of growth. It's purely because it supports such a large uh, population in the United States, and it's just a very diverse and expanded industry overall. So as we talk about managed care, and this is where I can probably bring in some of my business experience, right? I've worked in this industry for the last 10 years in a few health plans. And I'll talk more about the difference between health insurance and managed care, but just a little bit more about my background. So the last 10 years in health insurance. And prior to that, I was an industrial engineer working in manufacturing and assembly operations. I have a degree in industrial engineering, but what really connects my prior career path and what I'm doing today is the quality improvement aspects, right? I have a black belt in Six Sigma. That really helped me move from a traditional industry like manufacturing to a little bit more, I would say, transactional industry like health insurance. So that's sort of my background. I hope that helps you give a better perspective on where I'm coming from, a business perspective. So what we are presenting in the next few slides is not so much about technology; it's more about the use cases, right? I'm no techie. What I do at work is I bridge the gap between business and IT, right? So I help identify what are the use cases that we should prioritize and then get the software development team to work on. So when we talk about managed care, in today's world in the United States, a lot of health insurance is being managed through what are called MCOs. They're called managed care organizations. So if you look at managed care as a technical term defined by the Centers for Disease Control and Prevention, it's a term originally used to refer to prepaid health plans that furnish care through a network of providers under a fixed budget and managed costs. Increasingly, the term is also used to include preferred provider organizations. So if you think of health insurance, especially in the US, you have a few categories, right? So just to give you a little bit of a background, not many people understand how health insurance works, but we all use it in some way or the other. It's just sort of seamless in our day-to-day life. But if you look at how managed care plans are structured in the United States, you have what's called the government programs, where you have Medicaid plans, Medicare Advantage plans, and you have exchange plans. And then you have what's called the commercial line of business, where you have small group plans and some large group plans. So a typical example, I'm sure a lot of the folks on this call are probably getting their insurance through their parents, and their parents are probably working for a large corporation in the United States that provides health insurance benefits. So you would fall under what's called the commercial line of business. But there is a significant number of people in the United States who don't have insurance through their employers. They may be in the low income bracket, what's called the federal poverty level. So the U.S. government has thresholds where if an employee, if a person has income below the federal poverty level or certain thresholds that have been established by the Medicaid organizations, they will fall under the Medicaid plan. If you have, I presume if you have seniors in your house, 65 plus, they probably have what's called a Medicare plan. So the Medicare plan is what's given out by the government. The Medicare Advantage is the managed care version of the Medicare plan. And then you have exchange plans. So I'm not sure if many folks would recall about a term called Obamacare back in 2008, 2009. There was actually around 2013, there were legislations around expanding the access of health insurance to not just folks that fall under the Medicaid category or Medicare Advantage category or just commercial, but to also expand coverage to folks who don't necessarily fall in any of these buckets, but do need health insurance, and that's a significant number. And that's where Obamacare came in. It's also called the Affordable Care Act, which allowed certain people who didn't meet any of these conditions to go into a state exchange and apply for insurance. So that's called the exchange plan. So bottom line is you have the health insurance companies in the US. So just to name you a few large nationalized health insurance companies, you have companies like United Health Group, Aetna, Cigna, Humana. They're all for-profit nationalized health plans. So each of these health insurance companies have managed care plans. And each managed care plan on the Medicaid side is usually state-driven. So you have a New York Medicaid plan, and there's a New Jersey Medicaid plan, there's a California Medicaid plan. So there are 50 different Medicaid state organizations that are managing these Medicaid plans. And each of these health insurance companies are then contracting with the individual Medicaid organizations across these 50 states to come up with Medicare plans in that state. So that's the Medicaid landscape. And then you have Medicare Advantage, where these same health insurance companies I mentioned earlier, the United Health Groups, the Humanas, the Aetnas, they are contracted by the federal government to create these Medicare Advantage plans, which not only take on what the government would be providing in terms of Medicare benefits, but add a little bit more to that. So that's the managed side of Medicare. But let's move on to the core of the discussion today, which is use cases for AI. So if you look at predominantly the managed care health insurance side of the world, a key component of AI utilization is claims processing automation, right? So let's walk through a member journey. Like let's say I am a so I'm somebody who injured my leg in sports, right? I go to my PCP. My PCP is going to look at my leg and say, you know what, you need to go see a specialist. So depending on my insurance plan, I may have to require a prior authorization, right? So my specialist, the orthopedic specialist, will then call my insurance company and say, you know what, we have one Mr. Manku who injured his knee and he needs to be seen by the orthopedic. We need a prior authorization. So they then request the prior authorization, which allows their their specialist facility or group practice to see me as a patient. So there's a whole bunch of transactions that are created from just that one injury, right? So that one injury creates a prior authorization request. So that all these requests are going into some kind of a portal in the health insurance plan where providers are submitting these requests, right? So there's a ton of paperwork that needs to be reviewed by the clinical team to confirm that this person truly needs to be seen by a specialist. And following all of that, there are claims, right? So any transaction between a physician and a patient will result in a lot of claims being submitted by that physician to the health insurance plan. So there's claims that need to be processed. There are millions of claims that are processed every year. So if you look at high volume transactions, these two processes, claims processing and prior authorization, represent a significant amount of transactional volume that comes into the managed care health plans. So health plans are always looking at how do we reduce the amount of administrative burden that's required to process these, right? So if you look at every dollar that's spent in the United States healthcare industry today, about 89 to 90 cents goes towards medical costs and 10 cents goes towards administrative costs. So that administrative cost includes someone like me who's working in the health plan industry trying to create software. That administrative cost includes someone like me, someone like a call center representative. That includes a claims processor. It includes a clinician or a care coordinator who's reviewing the prior authorization request and making sure it's duly submitted and processed, right? So all that administrative waste, the goal is to reduce it, bring it down to a number that's lower and lower. So companies are always looking for automation, and AI is the next frontier there, right? So just to give you additional context in terms of metrics, right? So when it comes to claims processing, health insurance companies have a metric called first pass rate, which means, okay, if 100 claims came in, what percentage of those claims were processed systematically with no human intervention? Let's say that number today on industry average is 80%, right? So the remaining 5 to 10% claims are processed through additional IT interventions where somebody may go in and write a script to update that claim and let it go through the claims engine. So that gets us to 90%. But there are about 10% claims that do not have any what do you call automation at all. They are purely seen by claims processors manually. So which means somebody is taking the claim and going through a series of or documents somewhere that explain how to process the claim, what are the exceptions they need to understand. There's a lot of research that goes around it. So that claim may take an average 30 minutes to process, right? Where AI comes in, it's going to take in whatever is the thought process of that claims processor, and it's going to create these algorithms and build the machine learning AI capability on it to be able to train that algorithm continually as new cases keep coming in to be able to automate that. So eventually those manual cases will become automated, automatically adjudicated claims. And the same thought process works for prior authorization as well. It's the same exact scenario, right? You have 97% of authorizations in the United States are automatically processed, 3% go through manual intervention. And every organization out there is looking to reduce the 3% and make it more automated. So AI comes in, it clones the thought process of the reviewer into these algorithms. Then we talk about chatbots. So again, as Sana mentioned earlier, there's the process of dealing with not just health insurance. I would say any service oriented company whether it's a cell phone provider, a cable provider, or utility provider, or a health insurance provider. There are a bunch of calls that you need to make from time to time, and that can be a frustrating experience. We've all seen that, and I'm sure your parents may also be aware of that. So as more chatbots come in, the idea here is to be able to connect with the call center directly without any use of calls at all. So they have these where you can go online, you can type in Verizon.com, and it'll send you an immediate chat request comes in. I'm a virtual assistant. How can I help you? So all of that is AI, right? AI is helping take away the human intervention. Then we have other scenarios where we also, in the healthcare industry world, clinical research has proven that when you connect a member, let's say that has been admitted to the hospital and then discharged, if you connect that member to a primary care provider, to that member's PCP within, let's say, a week, there's a very high probability that particular procedure or surgery may go very successful. It's the follow-up care following in a discharge that's really very, very important. For example, when I tore my ligament, I ended up getting an ACL surgery, and immediately right out of the gate, I started getting calls from the hospital saying that you have to start connecting with a physical therapist. You need to make sure you have a physical therapy appointment. So they constantly follow up with you, right? But that was somebody calling me. I'm talking about 8 years back when I got my surgery done. They were calling me constantly, and today's day and age, no one wants to be called. Everybody prefers text. So the chatbot option is one way of identifying what does a member want. Does a member prefer to be called? Does a member prefer email? Does a member prefer text? So it's very personalized. What do you call communication channels? That's a lot of that is happening today in the healthcare industry, creating these personalized, member centric intervention paths for communication. We talk about call routing. That's another aspect. As much as we go digital, as much as we're going online, like through web-based, there is still certain population of our people, of our community that don't prefer to go online. So there'll always be a need for phone calls and call centers. But how do you make them more efficient? Can we utilize and understand from trends in the data? Okay, well, the last time somebody called for this particular reason, they were routed to XYZ department. Can we build that into the algorithm so that the next time the same call comes again, it's automatically routed without any human intervention? So going back to the concept of training the algorithm constantly to make it better, I think that's the beauty of AI, and that's something which no technology in the past has done. We've had things like RPA, robotics process automation, which would go in and update a script and automate and make some automation changes. But now with AI, we're seeing this constant use of feedback loops into the algorithm to enhance it and make it constantly better. So that's a classic use case. We also have scenarios where as much as we would prefer not to see fraud and abuse in healthcare, it does occur, right? So you have scenarios where physicians sometimes may be billing for 80 hours when they can only physically work for 40 hours or 60 hours. So a lot of that happens. You have some malpractice going on in the industry that needs to be controlled and audited by health plans. So this fraud abuse prevention use case helps with making sure that all these issues are prevented through a systematic, data-driven approach without any human intervention. Then we talk about billing. Within the billing world, you have what's called revenue cycle management. There's a big emphasis on how do hospitals and providers that are billing health insurance plans, how do they get their revenue sooner? So if you look at the way healthcare industry in the United States is structured, you have all these different pillars, right? You have the dentist, you have the optometrist, you have the physical therapists, hospitals. But at the end of the day, they're all getting paid through the managed care plan. So we call them also the payers. So you have the payers and the central of the pie, and then you have the providers that are around the circumference, right? So they're all connected from a payment perspective with that payer, the managed care health plan. So how do you optimize billing? How do you make sure that when a patient is seen in the hospital, there's a team of people that are going to be sending out these bills to the health insurance company. Their claims, they all sent through some kind of an automated process. But there are cases where these claims are not accepted correctly by the health insurance company. There might be errors in the billing. There might be omissions. They might have missed a diagnosis code. They might have missed a procedure code, forgot to populate something. So a lot of those things can be prevented through better identification of these issues up front. And that's where AI comes in. It's AI is the last frontier where companies have already automated up to 80-85% of their processes, and they're looking for the next incremental 15% to close the gap, right? So AI comes in there. It brings in the trainable model where robots are constantly trained and they continue to get better and better, right? So I think that's the beauty of AI. And that's a scary part of AI too at the same time, because you have a human that's going to be that needs a lot of training to get better, but in this case you have an algorithm that could be continually trained with these use cases that keep coming, with these scenarios that keep getting brought back into the algorithm. And then from an early intervention perspective, you also have the clinical. This is more of the clinical aspects, right? So a case in point being, uh, today there is a quality measure. So health plans are incentivized by various federal and regulatory agencies based on quality measures. So there are measures like access to care, making sure there's measures called BMI screening, blood pressure screening, diabetes screening. So the different preventive measures that are set up in the quality plans of health insurance companies, and they get incentivized by the federal agencies for good quality, right? But then there's also a big focus on early intervention, which means not just taking a proactive approach, but taking a more, sorry, not just being reactive, but being proactive by identifying, based on the data, is there a chance that Mr. Manku may have a certain disease based on his existing health data, right? Is there a chance that XYZ person may have a probability of getting readmitted to the hospital following a discharge within 10 days based on the data? So a lot of the data driven analytics is being powered by AI today. That's another classic use case of AI. So you can see a pattern here, right? Wherever you have high volume of work that requires looking at medical images, looking at charts, looking at reading through paperwork, reading through data, mining through tons of paper, or like as I mentioned, notes, right? Medical transcription notes is another big aspect of AI utilization. All this being done by AI. That's a huge opportunity to take away the manual work of having to go through read all this administrative work to identify the true diagnosis. So that's very much an AI centered effort. At the same time, you also have, like I mentioned, analytics. Powering data, using data to prevent issues ahead of time, and being able to be proactive rather than be reactive. So, in a nutshell, I think we've covered the last 30 minutes. We've covered a good perspective of healthcare from an AI perspective. We've tried to walk you through what are the different domains within healthcare, what are the potential use cases. And Sana, do you want to take it over and wrap it up?
Yeah, sure. Okay, so these were some of the sources we used, and there are more sources on the next slide as well. Yeah. Thank you for listening. I really hope you guys enjoyed it and learned about AI from this presentation.
Thank you so much. Thank you.
Thank you.